This is the story of the one. As a custodial supervisor at a high school, he knows that during cold and flu season, germs spread fast. It's why he partners with Granger to stay fully stocked on the products and supplies he needs, from tissues to disinfectants to floor scrubbers. All so that he can help students, staff, and teachers stay healthy and focused. Call 1-800-GRANGER, click Granger.com, or just stop by. Granger, for the ones who get it done.
Hey everyone, welcome back to my podcast, Anatomy and Physiology Bit by Bit. I'm your host, Dr. Steve Sullivan, coming to you from Bucks County, Pennsylvania, just outside of Philadelphia, where I've been teaching A&P since 2002. In this episode, we're going to talk about pregnancy and childbirth. In the last two episodes, we covered embryonic and fetal development from fertilization to just before birth. So since we already discussed the changes that take place in the gametes, the zygote, embryo, and fetus, today we'll talk about the changes that take place in the expectant birth mother and how the fetus leaves the uterus to become a neonate, which is the medical term for newborn. So let me ask you this. Do you have trouble remembering everything you have to remember in anatomy for exams? There's a lot of memorization in anatomy, and although people like to downplay the importance of it, memorizing is learning. Don't just take it from me. Cognitive scientist Dr. Daniel Willingham, professor of psychology at the University of Virginia, says memorization is, quote, activities undertaken in the desire to commit something to memory so that it is readily accessed. But Willingham says simple repetition isn't a very good way to do it academically. You need to make meaningful connections to existing knowledge. It requires deep processing. But before you can apply the anatomy to the physiology and convey that knowledge on an exam, you have to know what the anatomical structures look like, where they are, and what they're called. And that's just something you got to memorize. One tool out there that is helping students with the anatomy is called Anatomical Cheatsheets by lifesizedlearning.com. These are literal life-sized sheets you can lay over someone or on a table or bed, and each sheet has a labeled anatomical illustration on it that is life-size. There are a lot of applications for this cool product, and recently I talked with Michelle Shaw. She is the president of Life Size Learning and the inventor of Anatomical Cheat Sheets. We talked about their anatomical cheat sheets and how they help students make the meaningful connections that support learning anatomy. So please help me welcome Michelle Shaw from Life Size Learning. Okay, Michelle Shaw, president of Life Size Learning and inventor of Anatomy Cheat Sheets. Welcome to the show.
Thank you so much for having me.
To get started, why don't you introduce yourself to the listeners, tell us a little bit about your background, and what got you into making products for learning anatomy?
Absolutely, Steve. Thanks. My name's Michelle Shaw. I'm a licensed massage therapist in Pennsylvania and in Florida. And I really have a passion for helping people, especially helping people learn. And I've always been a visual learner myself. So I had this idea while I was in my massage school training in Bethlehem, Pennsylvania. And, it's funny how we all have those ideas once in a while and they kind of roll around in your head. And then eventually you decide whether or not you're going to pursue it. And I did. And I had the patent issued for this idea for what we are calling the anatomical cheat sheet was issued in 2021. And the anatomical cheat sheet is a life-sized learning aid for studying anatomy. It's printed on a chiffon fabric so that you could, if you'd like, lay it over top of someone and you can learn as you are palpating them, as you're touching them. And the person under the sheet can see through it. They can breathe through it. It's lightweight. It's portable. Yeah, it's pretty handy.
Oh, that's pretty cool. So did your studies in Bethlehem? That's actually not very far from me.
No, not at all.
So tell me more about these cheat sheets. So they're sheets.
They are actual sheets.
Kind
Yeah.
of fun, right? So cheat sheets, they're actual sheets, like almost like bed sheets, but you
Correct.
lay them right down on top of your study partner.
Exactly. So with the exception of the fabric being a chiffon, it's a micro chiffon, which makes it pretty transparent and it makes it breathable. The beautiful thing about the chiffon also is one of the ways that you can use these sheets is if you were to say, you would take multiple anterior views, let's say the muscular and the skeletal, for instance, and you would hang it in front of a light source, say a window. Then you can see how these systems innervate together. You could identify where a bony landmark is underneath someone's muscular exterior, So it becomes pretty cool when you're able to see through these layers of sheets, and it becomes almost holographic when it's, in front of a light source. It's pretty cool.
Oh, that's pretty cool. It reminds me of those old anatomy books where you have the transparencies that
With the
just keep laying
cells,
over each
yes,
other,
exactly.
and you get to see different depths of the tissues. I like that. So,
Yeah.
so it's not just muscles then. You have different organ systems.
Many different systems. Yeah. Currently, we have, let's see, there are now 23 different sheets. So you have your muscular, your skeletal, your nervous, your circulatory, and then those two systems separate. So you have your arterial and your venous separate. And then we have a joints and ligaments chart, which is really great because it's cut down the midsection. So you have both an anterior and a posterior view on one sheet. Then we have the origins and insertions of the muscles. That's very popular amongst massage therapists, especially. Trigger point chart is my favorite, which is a form of neuromuscular work where, we have these, what we call trigger points all over our body. And it is a map of different pain referral patterns. So, let's say I have a pain in my pinky finger, like I'm just having numbness and tingling. Well, that could be due to an active trigger point in my tricep. So with these charts, it'll show you all the pain referral patterns. And we spent a good 10 hours, the graphic designer and I did, making sure that none of the color combinations are directly next to each other, none of the same colors. So it's visually easy on the eyes.
Oh, that's really
And
cool.
it is really cool. And also the acupressure. So if you were learning the meridians in Chinese medicine, um, that as well has been, played with, and fine-tuned and refined. These are illustrations that were done for bar charts, quick study guides. And those are still on the market. There's 150 million of them sold at this point. So very
Wow.
beautiful, popular artwork by an artist named Vincent Perez. And what we did was we just went in there and kind of cleaned things up. We added a couple of things, we changed a couple of things, and yeah, I'm very, very happy with the outcome. Lymphatic, that's a really
Okay.
popular one. Yeah, the lymphatic system. Lymphatic massage especially has become, really necessary in the medical community. Oh, we the chakras. Yeah, the chakra, if you're studying, energy work, the chakra system is really beautiful also.
So you thought of everything. You went all the way across the entire gamut.
And I'll tell you what, Steve, we're not even close to being done. I'm currently enrolled in an aesthetics course so that I can also be a skincare specialist. And so as we're working on these little models that are pretty much just from, the collarbone up, I'm realizing, wow, I really need to make these sheets smaller, so that I can include them into, these programs for people that are learning skincare. So there's that. And then my patent also covers injection sites. So I'll be soon coming out with ones that are just focused on specific regions where you're going to be doing an injection and where you may have the point of insertion for the needle. And the other great thing about this fabric is that you can use dry erase markers on them and it washes right out. So it's kind
That's
of
neat.
handy to have,
Smart.
like,
Smart.
yeah, just a small area, a region that you're going to be performing an injection, and then, being able to pinpoint exactly where that's going to go. And the other big part about this whole patented product is that it covers all mammals. So we'll be branching out into veterinary at some point. Again, as my first animal, of course, will probably be a horse. Yeah, all about helping all the creatures out there, right?
That's pretty cool. I used to spend a lot of time in Thailand for
Oh
work,
yeah.
and one of the photos I have on my website that I use for my students is a photo I took of a mural in a Buddhist temple in Bangkok. That's not just a temple;
Oh,
it's also
which
a
temple
massage
was
school.
that?
Wat Po.
Oh, I was there. Yep.
Oh, did you go to Wat Po? So
Yeah,
you've
I
seen the
went and
murals
studied.
with all of the massage stuff
Absolutely.
on them?
Yeah. Oh, it was beautiful. I actually had a Thai foot massage at Watpo.
Okay.
And I had the best pad Thai I've ever had in my life at a woman's house at a back alley from Watpo. Oh,
We used to
cool.
spend 4 or 5 weeks there at a time because
Yeah.
my wife and I taught classes there for the College of New Jersey.
Oh, how great. Love
And
it.
we spent a lot of time in Watpo. Watpo is always one of our first visits.
I spent about a month there when I studied, and my studies were up in Chiang Mai. But
Oh, nice. I love Chiang Mai.
yeah.
Anyway, let's get back to your
Ha.
anatomical cheat sheets. So,
Yeah, thank you.
in addition to massage therapists, are you seeing them being used across the spectrum of students preparing to be healthcare professionals?
Oh my gosh. Yeah, it's really been just kind of mind-blowing, honestly. Yeah, let's see. Let me kind of rattle off a few places. Lots of A&P classrooms, medical offices and clinics have them. Geez, yoga studios, fitness centers, lots of different types of healing spaces, dojos. Actually, I've had somebody line their dojo with the sheets, and it's been so well received. So
That's
that
cool.
was,
What
yeah,
are
pretty
some of
cool.
the big educational institutions who are using them for learning anatomy?
Yeah, so I'm pretty excited. I don't want to name the name because we're in negotiation, but we just had a meeting yesterday with a medical university in Philadelphia. So, yeah, they'll be putting in a purchase order very soon. Very excited about that.
Wow, that's great.
Let's see. There's, gosh, the Colorado Healing Arts Center. So they're out there in Colorado. They're at a technical institute here in Florida called Big Bend Technical College in Perry, Florida. They're at a massage school at the Philadelphia School of Massage. They're also at Alpha School of Massage in Delaware. Like I said, lots of massage schools because that's kind of how we launched this.
Okay.
They're also at a place called the Institute of Integrative Manual Therapy in Connecticut, and that's a pretty renowned school there. And gosh, they're in community colleges all the way out in what's it called now? Muskogong, Michigan. So
Okay.
yeah, they're in Trinidad. I mean, they're all over the place. They're in
Wow, great
Denmark.
job.
Yeah, they're in Paris. So I couldn't be more thrilled. It's been a big year.
That's cool. Can I see one? Can you hold one up
I
for the
sure would
Zoom?
love to show you one. Let's see here. I think I have the muscular anterior view for you. There's that.
Oh, neat.
Yeah.
And that
And let me
lays
show
like
you.
right over. I love all the labels and the detail of the muscles. It looks really, really good.
Let me show you the lymphatic system. It's really
Okay.
cool. And if I can, I'll even try to hold it up in front of the muscular system since I have a window behind me. We'll see if that works.
I can't believe how good the artwork is on a chiffon sheet. It looks really, really good. The level of detail with the lymphatic system is really impressive.
Never forget the first time I hung them together in front of a light source. I was at um, a client's house down here in Siesta Key, and she had this beautiful big window, and she actually purchased a whole set of sheets for me. She loved them, and we hung them all together, and we both stood there in all of it. We're like, wow.
For people who are listening to the podcast, I will post images on my Instagram account so that you can check it out. And I'll post links on the show notes to how you can find all of that stuff.
Thank you so much.
So let me ask you this. How can people get their hands on these things?
Well, we've got a few different ways now. You could go directly to our website, which is lifesizedlearning.com. That is the name of the company, Life Sized Learning. And we're also on Amazon. We had a very successful season selling at these conventions. People were more than happy to make the investment into their practice, their career, as a teaching aide, if they're an educator, or as a student to learn more effectively. I love using them in my own private practice when I have a client come in and I can kind of show them, what's going on within them. They can look and see, oh, wow, okay. Now it makes a little bit more sense. When someone sees something life-sized on a larger scale, it seems to sink in a little bit better. We do have a really wonderful program right now for people who love these sheets so much that they want to sell them. We developed an affiliate program. So that's been a huge success. We have a lot of people signed up right now, and all it involves is them getting their own code. And then people go to our website and then they, can enter that person's code. And it's a nice way to just, give back because word of mouth has been such a successful strategy for us. Being a small business, you don't have a lot of money starting out. So the money to do a national marketing campaign simply was not in the cards. But I'm a believer that if you take your time, and you have good intentions, that it'll be fine. It all works out.
Yeah, I know. And traveling and getting to these conferences and things, that's a huge expense. So it's
Sure
really
is.
nice when people are using them and telling other people that they really like them and how they're
Right.
working for them. That's great. And hopefully people who are listening now will go to your website, lifesizelearning.com, or maybe check you out on Instagram. How can they do that?
They can do that. Yeah, Life Size Learning on Instagram and Facebook.
Okay.
Same. Yeah.
Great. So I will post links to all of those in the show notes. So that way, if you're listening, you don't have to remember that. Just go to the show notes, click the links, and you'll
Right.
be able to see anything that you want to see
That's
from Life
great,
Size
Steve.
Learning.
Thank you.
I think these anatomical cheat sheets are really cool. I'm definitely going to look into seeing what they could do for my students.
More often than not, at a convention, the first thing that someone says is, "Oh, I wish I had this when I was in school," you know?
I've
And
said
that
that so
was,
many times
yeah.
about things that come up,
Yeah,
like
that's
the
kind of
internet.
how it happened. I was just about to start a massage in clinic while I was still in school. I kind of opened my eyes and there it was, right on the person. So just saw it.
That's
And
fantastic. Well, I think you're doing a great job. This was a really good idea, and it looks like you have executed that idea pretty well.
it's all a learning experience, and I feel super grateful and blessed to be joined by people in my industry that are so supportive and really just wanting to help accelerate this because it seems to be the general consensus that these are just really effective learning aids. So the more I can help people learn how to help other people, I feel like that's what I'm here to do.
Well, I think these are going to be really helpful for students to make meaningful connections that turn memorizing into effective learning. And
Sure.
that's what we need to focus on with things like anatomy.
I sold a number of the sheets to some girls that were all rooming together who were in med school. They're like, we're gonna put them up in our dorm room. So
That's
that's
great. My
awesome.
son's a chemistry major, and my wife and I have this really good friend who's known my son since he was 3 years old. And for one of his high school graduations presents was a periodic table of elements shower curtain. Yeah,
Somebody just bought two of them at the National Convention, AMTA convention in Dallas 2 weeks ago to use in her shower. So
there you
yeah,
go. Well,
why not?
Michelle, thank you so much for joining me. I really liked learning about the anatomical cheat sheets. I'm really looking forward to seeing you at the HAPS conference in
Steve, it
May.
was a pleasure. Same here. Thank you so much.
Thank you once again to Michelle Shaw, president of Life Size Learning and inventor of Anatomical Cheat Sheets. You can check out their anatomical cheat sheets on lifesizelearning.com or follow them on Instagram at lifesizedlearning. You can see some images of their anatomical cheat sheets and how they're used. I'll also post all pertinent links in the show notes, and I'll probably post some images of the anatomical cheat sheets on my Instagram account. Okay, let's move on and talk about the changes that occur in an expectant birth mother during pregnancy. Another term for pregnancy is gestation. In humans, gestation is the time and events that take place from fertilization, also known as conception, until the birth of the neonate or newborn, which we call childbirth. On average, it is approximately 38 weeks, or 266 days. However, when one is pregnant and sees their healthcare practitioner, the due date, which is the date they estimate the birth will take place, is calculated from the date of the onset of the last menstrual cycle. That means day 1 of gestation is whatever date the expectant birth mother's last menstrual period started. Since ovulation typically takes place 14 days after that, and fertilization has to take place within 24 hours of ovulation, the gestational calendar from a clinical perspective is actually 40 weeks, or 280 days. Remember, the ovulated secondary oocyte is a 24-hour lifespan. That's why fertilization has to take place within that time frame. The entire duration of a pregnancy is called term. You've heard people say the phrase carry to term. That means the pregnancy made it all the way to birth. Remember, many fertilizations do not become full-term pregnancies for a variety of reasons. The full term is divided into 3-month intervals called trimesters, the first, second, and third trimesters. Okay, bear with me for a minute because I'm going to review a little bit from the previous episodes to make sure we're all on the same page with what's happening to the fertilized ovum during pregnancy. Then we'll talk about the changes in the expectant birth mother's body during pregnancy. Remember that we can use the term conceptus to refer to the product of fertilization at any stage. That includes the zygote, blastocyst, embryo, fetus, etc. For the first 2 weeks, we have a blastocyst. From day 16 to the end of week 8, it's an embryo. And from there on, until birth, it's a fetus. Also, recall that the fetus is attached to the placenta by the umbilical cord. Nutrients from the expectant birth mother are stored in the placenta, which then delivers them to the fetus. The fetus sends its metabolic wastes to the placenta, which then delivers them to the expectant birth mother, whose organs then dispose of them. The placenta also secretes hormones that regulate the development of the fetus, the pregnancy itself, and development of the expectant birth mother's mammary gland. I briefly mentioned the hormones that regulate pregnancy in the last episode, but I didn't talk about what they actually do. So we'll take the time now to do that. There are 4 primary hormones influencing pregnancy. They are estrogens, progesterone, human chorionic gonadotropin, and human chorionic somatomammotropin. Clinically, we can monitor these hormones in the blood of the expectant birth mother throughout the pregnancy to get a feel for how the fetus is doing. Initially, the corpus luteum secretes progesterone and estrogens. Remember, the corpus luteum is the remnant of the ruptured ovarian follicle left behind after ovulation. If there is no fertilization, the corpus luteum degenerates within a couple of weeks, and those hormone levels decline. That's why the stratum functionalis layer of the endometrium is shed during menstruation. After several weeks, the placenta has developed enough to take this role over and be the primary source of pregnancy hormones. And by week 17, the corpus luteum has degenerated completely, and the placenta is the only source of these hormones. So let's take these hormones apart one by one, starting with human chorionic gonadotropin, or HCG. Early on, post-fertilization, HCG is secreted by the chorion of the blastocyst. Like I mentioned in the past, this is the hormone whose breakdown products end up in the pregnant person's urine within the first 10 days since conception. So it is what over-the-counter pregnancy tests are looking for. Think about the name of this hormone. Human, because we're humans, chorionic, because it comes from the chorion, and gonadotropin, because it targets the gonad, or in this case, ovary. HCG keeps the corpus luteum from degenerating, so it continues to secrete estrogens and progesterone, inhibiting the start of menstruation. The placenta also secretes HCG. Levels of HCG peak during the 10th to 12th week of pregnancy. After that, secretion declines and remains fairly low for the rest of pregnancy. Without human chorionic gonadotropin, the blastocyst would have nowhere to implant and would exit the uterus with the menstrual period. I'm going to talk about estrogens and progesterone together for a minute. By the time the pregnancy is to term, estrogen secretion has increased to approximately 30 times what it is in a non-pregnant person. The placenta is responsible for both estrogen and progesterone secretion after the corpus luteum degenerates. Both estrogen and progesterone inhibit the anterior pituitary from secreting follicle-stimulating hormone and luteinizing hormone. Without these, new ovarian follicles won't mature and ovulate during pregnancy. We don't want another ovulation when you're already pregnant because that could end up being fertilized, and if you already have an embryo that's a couple of months in, you don't want another one starting to implant. As for estrogen, it converts androgens from the expectant birth mothers and the fetus's adrenal cortices into estrogens. The most abundant estrogen of pregnancy is estriol, but its effects are relatively weak. Estradiol is less abundant, but 100 times as potent as estriol. Estrogen has a wide array of effects on both the fetus and the expectant birth mother. It stimulates the growth of the uterus, the external genitalia, the mammary ducts, and breasts of the expectant birth mother. And to make the pelvis more flexible to support the growing fetus and allow it to pass through during childbirth, estrogen increases the elasticity of the pubic symphysis and sacroiliac joints. For a long time, it was thought that this was the result of the hormone relaxin, like it is in other animals. However, more recent research has shown that this is not the case in humans, as estrogen is the primary driver of relaxing the pelvic ligaments. Progesterone inhibits contractions of the myometrium. Remember, that's the muscular layer of the uterus. while the conceptus is still developing so the uterus doesn't prematurely eject it. You may remember from episode 72 that the decline in progesterone during the menstrual cycle is what causes the onset of menstruation. So keeping progesterone levels up prevents menstruation while pregnant. With the help of relaxin, progesterone also stimulates the decidual cells of the endometrium to multiply. In episode 73, I discussed decidual cells because it is what the blastocyst uses for its nutrition. Progesterone also stimulates the development of the mammary gland's secretory acini, which will eventually be responsible for producing the milk needed to nourish a newborn. In the last episode, I briefly mentioned human chorionic somatomammotropin, or HCS, which is also secreted by the placenta beginning around the 5th week of development. As the placenta grows during pregnancy, HCS secretion increases. In fact, more HCS is secreted than all other pregnancy hormones combined. Now, what human chorionic somatomammotropin does isn't entirely understood. In fact, you may hear it called human placental lactogen because it's involved in lactation in non-human mammals, but it doesn't play a role in lactation in humans. Here's what we think it might do in humans. Spare glucose in the expectant mother's body so more is available for the fetus, and liberate fatty acids from the expectant birth mother's adipose cells so they can use it for energy in lieu of the glucose that it's sending to the fetus. Now, there's more to the hormonal changes of pregnancy than what we typically associate with reproductive hormones. If you want to review the hormones I'm about to talk about, check out episodes 33 through 38, which cover the endocrine system. There's a lot of other hormones responsible for the changes in a pregnant person's body, including pituitary hormones like thyroid-stimulating hormone, or TSH, prolactin, PRL, and adrenocorticotropic hormone, ACTH. The pituitary and thyroid glands enlarge by about 50% during pregnancy. TSH from the anterior pituitary and human chorionic thyrotropin from the placenta stimulate an increase in thyroid hormones, raising the metabolic rate of the expectant birth mother and fetus. An increase in parathyroid secretion stimulates osteoclasts to break down bone matrix and release calcium into the blood. Adrenocorticotropic hormone stimulates the adrenal cortex to secrete glucocorticoids, which might result in freeing up amino acids so the fetus can synthesize its necessary protein. Aldosterone, a mineralocorticoid from the adrenal cortex, increases, resulting in fluid retention. The increase in blood plasma contributes to a rise in maternal blood volume. Now, when I teach A&P, and when I record this podcast, I preface it by saying, unless otherwise stated, everything I explain is assuming an average, healthy, non-pregnant human adult. Being a newborn, a child, having an illness or injury or congenital anomaly, or being pregnant changes the anatomy and physiology of the individual. So now I will talk about the adjustments the expectant birth mother's body has to make to accommodate for a pregnancy. We'll start with the digestive system, nutrition, and metabolism. You've probably heard of morning sickness. This is the nausea typically associated with the first trimester. It doesn't happen to everyone, but it is really common. Why this happens? We don't really know. Some believe it's caused by the rising levels of estrogen and progesterone decreasing digestive motility, meaning the intestines do not propel their contents as efficiently as they do under normal circumstances. Others think this may be an evolutionary adaptation that protects the fetus from harmful substances. You see, the first trimester is when the embryo and fetus undergo their most rapid development. There's a lot of cellular activity and mitosis going on. This is when the conceptus is most vulnerable to toxins. It's also when the morning sickness typically happens. Morning sickness causes the pregnant person to avoid spicy or sour foods, leaning more toward a blander diet to avoid upsetting their stomach. These are the foods that typically have more toxic chemicals in them. Interestingly enough, there seems to be a correlation between morning sickness and a lower rate of miscarriages as well as larger, healthier babies. Now, morning sickness isn't just nausea all the time, it can also result in vomiting. When the vomiting is too severe, it may require medical attention, and this is called hyperemesis gravidarum. Emesis means vomiting, and gravid means pregnant, so hyperemesis gravidarum means excessive vomiting in a pregnant person. The decrease in intestinal motility can also cause constipation, which is a decrease in the frequency of bowel movements. Another digestive symptom is gastroesophageal reflux disease. This means the acidic gastric juice is making its way from the stomach backwards into the esophagus. Since the esophagus doesn't have the protective lining the stomach does, the hydrochloric acid of gastric juice can damage its epithelial lining. This is often called heartburn because the acid causes a burning sensation and the esophagus runs through the thoracic cavity posterior to the heart. As the fetus gets larger and larger, the uterus pushes up on the stomach, forcing the gastric juice into the esophagus. In order to account for the increased cellular activity of pregnancy, an expectant birth mother's metabolic rate eventually increases about 15%. This results in extra heat production. Add to that the fact that they're carrying extra weight, and the expectant birth mother may feel warmer than usual. Here's something interesting. Even though the appetite may increase sharply in a pregnant person, there's only a need for about 300 extra kilocalories per day to accommodate the pregnancy need for energy. Now, as I mentioned in the last episode, the fetus's nutrition demands in the third trimester are usually more than the expectant birth mother can consume and absorb via the digestive tract. This is why the placenta stores nutrients early on in the pregnancy. Those nutrients are released to the fetus in the third trimester. Protein, iron, calcium, and phosphates are among the biggest needs for the fetus. As you can imagine, iron is a big one. Without it, it will be difficult to meet the demand for extra red blood cells, not to mention the fetal red blood cells. Most obstetricians recommend a supplementation of prenatal vitamins and minerals for adequate fetal development and to avoid maternal deficiency syndromes. Another important one is vitamin K, which is essential for the coagulation of blood, specifically prothrombin synthesis. The bacteria in our gut synthesize vitamin K for us, but since the fetus and newborn don't yet have a mature gut microbiome, supplemental vitamin K is often given late in pregnancy to promote fetal synthesis of prothrombin. Here in the United States, it is standard practice to inject newborns with vitamin K to minimize the risk of a bleeding disorder called neonatal hemorrhage. Two other vitamins that are essential for fetal development are vitamin D for calcium absorption and vitamin B9, which is also known as folic acid or folate. Folic acid supplements help minimize the risk of birth defects involving the central nervous system. Okay, let's talk about the integumentary system for a minute. Since the breasts enlarge and the abdomen expands, there is a need for skin growth to cover them. There is also going to be an increase in subcutaneous fat in the hypodermis. Sometimes the excessive stretching of the dense irregular connective tissue of the dermis results in torn collagen fibers causing stretch marks, which are called striae. There may also be an increase in pigmentation of the areolae of the nipples and the linea alba. Remember, the linea alba is the midline tendon connecting the left and right rectus abdominis muscles of the abdomen. When this happens, it's known as linea nigra, translating to black line. You may have heard of the mask of pregnancy, which is called cloasma. It's a temporary increase in melanocyte activity, causing an increased pigmentation in the face. As for the respiratory system, the number of breaths per minute don't increase, but the volume of air inhaled and exhaled per breath does. Remember, we call that tidal volume. It makes sense that there would be a need for more oxygen intake and carbon dioxide expenditure because there is an increase in metabolic rate. But there's more. The hormone progesterone actually increases the sensitivity of respiratory chemoreceptors for carbon dioxide. By setting that target a little bit lower, the expectant birth mother can keep a lower than normal level of carbon dioxide in their blood, which helps the diffusion rate of carbon dioxide from the fetal blood so the fetus can get rid of its CO2. Another thing they may notice is the fetus putting upward pressure on the diaphragm, making breathing a little bit more of an effort than usual. All right, let's talk about the circulatory system. During the course of the pregnancy, the expectant birth mother's blood volume eventually increases to about 30% more than usual. This is mainly due to fluid retention and the increase in blood cell production. During the first 2 trimesters, the heart pumps up to 40% more blood per minute than when not pregnant. However, for most of the 3rd trimester, it's back down to pre-pregnancy levels. The expectant birth mother may also experience venous abnormalities like hemorrhoids, varicose veins, and swelling in the lower extremities because the enlarged fetus-filled uterus exerts pressure on the large blood vessels of the pelvic cavity, impeding venous return. Speaking of pressure from a full uterus, it's also exerted on the urinary bladder. So the urinary bladder ends up being able to hold less urine before the pressure causes the need to urinate. Add to that a 50% increase in glomerular filtration rate, and you have a significant increase in urinary frequency and urgency. And that's even though aldosterone increases during pregnancy promote water and salt retention by the kidneys. Now, obviously, the uterus grows during pregnancy, and there is fairly significant weight gain by the expectant birth mother. A non-gravid uterus weighs about 50 grams, but by the end of the 3rd trimester, it could be up to 900 grams, and that doesn't even include the fetus. That's just the weight of the uterine tissue itself. Okay, now it's time to talk about childbirth. So let's start with talking about the position of the fetus inside the uterus. Now, most babies come out head first during childbirth, but the fetus isn't in that position until about the 7th month of pregnancy. That's when the fetus rotates into the vertex position, which means head down. The head, being the largest diameter structure of the fetus, is the force that widens the cervix, vagina, and external genitalia during childbirth. The prime mover of childbirth is the myometrium, the smooth muscle of the uterus, but we'll also see that the fetus may contribute to its own cause a little bit as well. So let's talk about that smooth muscle of the uterus and what stimulates it to contract. In the 2nd and 3rd trimester, the uterine myometrium starts contracting, but these contractions are not true labor contractions. They're referred to as Braxton-Hicks contractions and are the body's way of preparing for labor. Sometimes they're called practice or false labor contractions. They're common and they're normal. Sometimes they're a little hard to differentiate from true labor contractions, but there are some key differences. Braxton-Hicks contractions tend to be irregular in frequency, short in duration, weaker than labor contractions, and they don't increase in frequency as time goes on. That's all different from our true labor contractions that we're going to talk about in a few minutes. The process of giving birth is called parturition. It begins with the onset of true labor contractions of the uterine myometrium. There is significant hormonal control of these true labor contractions. For example, during most of the pregnancy, uterine contractions are inhibited by progesterone. But progesterone levels off in the 3rd trimester. Estradiol secretion continues to increase, which does stimulate uterine contractions. Also, the posterior pituitary increases its release of oxytocin in the 3rd trimester, while the number of oxytocin receptors in the myometrium also rises. Oxytocin not only targets the myometrium directly stimulating contraction, it also targets the fetus and stimulates it to secrete prostaglandins, which then stimulate myometrial contraction. You may have heard of the drug Pitocin. It is a synthetic form of oxytocin used to induce labor. Late in pregnancy, the fetus increases its cortisol secretion from the adrenal cortex and oxytocin from the posterior pituitary. Some think that these fetal hormones may increase the placenta's estrogen and prostaglandin secretion, respectively. Finally, the movement of the relatively large fetus in the later months of pregnancy could stretch the uterus and stimulate contractions. The myometrium is smooth muscle, and stretching any smooth muscle increases its contractility. The large head of the fetus at this point should be pushing against the cervix, which is also sensitive to stretch. All right, so now let's focus on the actual labor contractions. At first, labor contractions occur about 30 minutes apart, eventually progressing to about 1 to 3 minutes apart and increasing in intensity. The contractions happen in a wave-like pattern, with the stronger ones happening at the fundus, the most superior part of the uterus, and making its way down toward the cervix, pushing the fetus inferiorly. You may remember, way back in episode 1, I talked about positive feedback systems, and the most common example is childbirth. Labor contractions are induced when the head of the fetus stretches the cervix. This stimulus results in a sensory nerve signal that travels to the central nervous system, reaching the hypothalamus. The hypothalamus has axons that extend into the posterior pituitary. In the axon terminals are synaptic vesicles filled with oxytocin. The oxytocin is released by the posterior pituitary into the blood. When it reaches the uterus, it stimulates further contraction of the myometrium, pushing the fetus further into the cervix, toward the vaginal canal. This is a neuroendocrine reflex arc because it uses both neurons and a hormone. It's positive feedback because the stimulus that started it is enhanced by the result of the reflex. Eventually, another reflex travels from the uterus to the spinal cord and to the skeletal muscles of the abdomen, which begin to contract. In addition, the expectant birth mother voluntarily contracts the abdominal muscles to help increase the force on the fetus, driving it out of the uterus. The intense pain associated with labor is from two main sources. The first is the loss of blood flow, or ischemia, that the uterus experiences with the myometrium contractions being so strong. The second is from the physical stretching of the cervix and vaginal canal by the fetus. To increase the flexibility of the tissue of the perineum, the region between the vagina and the anus, the healthcare practitioner may perform an episiotomy. This is an incision in the vulva that widens the vaginal orifice. All right, now we're into actual labor, and there are 3 stages of labor. They are the dilation, expulsion, and placental stages. Labor tends to last longer in people for whom this is their first birth than for people who've already given birth previously. The dilation stage, which is the first and longest stage, typically lasts between 8 and 24 hours for first-time mothers, but may be much, much shorter for people who've done this before. As you may have guessed, the dilation stage is characterized by the dilation or widening of the cervical canal, meaning it widens before the fetus begins to come out. We also see an effacement or thinning of the cervix as well. Ultimately, we're looking for the cervix to dilate to about 10 centimeters in diameter, matching that of the typical fetal head. This is the stage that sees a rupture of the amniotic sac and release of the amniotic fluid through the vaginal canal and out of the body. This is what people are talking about when they say their water broke. The second stage is the expulsion stage, which in first-timers can last from 30 to 60 minutes on average. But if it's not your first birth, it could be over in as little as 1 minute. The expulsion stage begins when the fetal head exits the cervix via the external os and enters the vaginal canal. It isn't completed until the neonate is fully outside the birth mother's body. When the top of the fetal head is visible, it is said to be crowning, as it stretches the mother's vulva. Since the head is the largest and least flexible region of the fetus, it is the most challenging part to deliver. Once it's out, the rest of the body usually follows fairly easily, unless there's a complication like a shoulder is stuck on one of the pelvic bones, for example. When the neonate is fully expelled, the blood of the umbilical vein is drained into the baby. Then the umbilical cord is clamped in 2 places and cut between the clamps. Even though the fetus is out and is now considered a neonate, labor is still not quite finished. We still have the third and final stage, which is the placental stage. After the baby is out and enjoying its first few minutes in the outside world, the uterus continues to contract. The placenta begins to detach from the uterine wall and about 350 milliliters of blood is lost. Contractions of the myometrium clamp down on the blood vessels and prevent even more bleeding. The continued contractions of the myometrium expel the placenta, the amnion, and the other fetal membranes. These are sometimes called the afterbirth. It's really important to be sure all of these structures and tissues are expelled, because if any of them are left in the uterus, they can cause massive bleeding. Okay, so now that the birth is over, You have a new baby. You're done sleeping for a long time, but again, you have this beautiful little addition to your family. But now you got to get your body back to its pre-pregnancy state. The time period after birth is referred to as postpartum. The first 6 weeks of which are called the puerperium, when the new birth mother's anatomical structures and physiological processes stabilize and the reproductive organs nearly return to their pre-pregnancy state. The uterus shrinks back down to its usual size in a process called involution. If the new mother is lactating, 50% of involution is completed in the first week, and it only takes about 4 weeks for total involution. Involution is achieved by autolysis of uterine cells by their own lysosomal enzymes. This causes a vaginal discharge called lochia for the first 10 days or so. Lochia starts out as kind of bloody in the beginning, but eventually turns into a thinner, clearer serous fluid. There are 2 reasons why lactation speeds up involution. First, it decreases estrogen secretion, which would otherwise inhibit myometrial contraction. Second, it stimulates oxytocin secretion, which causes the myometrium to contract and firm up the uterus sooner. Okay, that's a lot. We went through a lot there. In the next episodes, we'll talk about aging, we'll talk about maybe some complications that are associated with pregnancy, and we'll also get into genetics. But that's going to take a few more episodes. Once again, I want to thank my guest, Michelle Shaw from Life Size Learning. Please check her out on lifesizelearning.com and look at those anatomical cheat sheets. They are amazing. A really, really good study tool for anyone taking anatomy. And thank you once again for continuing to listen. I hope this is helping you get your B or better in A&P. Please feel free to send me an email at minus55media@gmail.com if you have a question. Maybe I'll answer it on an episode. Or feel free to follow me on Instagram at StudentHelp4AP. That's the number 4, AP. And check out some of the things I'm posting on there. I'm so glad you're listening. I will talk to you next time. Anatomy and Physiology Bit by Bit is a production of Minus 55 Media and is hosted by the Believe Network. Please take the time to rate my show and leave a review. You can also check out the content I post on Instagram and YouTube as at StudentHelp4AP. That's the number 4, AP. Special thanks to my family, Bucks County Community College, and McGraw-Hill Education, where your instructor can find Anatomy and Physiology Digital Suite, my low-cost tutor video-based digital learning solution for anatomy and physiology currently being used at several colleges and universities. If your instructor isn't using Digital Suite, let them know about it. The link is in the show notes.